Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. It is quite convenient for the study. My dear friends, as usual, today also we will discuss a very important topic in Kamarbritya, and especially in the developmental pediatrics. One of the most common problem that we are facing is global developmental delay. Global developmental delay is one of the most common problem among the in the context of developmental pediatrics. Now, when we talk about development, we know that for the assessment of the development we have got different milestones, but basically the development is divided in different domains. One domain is motor domain, another domain is fine motor domain, another domain is social domain, another one is language domain, and last one is cognitive domain. So these are the different types of domains of development. So actually when we are looking into the developmental process, we actually assess in terms of these domains, which domain is get affected, whether only motor domain is get affected or rest of the domains are normal, whether it is only the developmental milestones related to the language is get affected, rest of the things are open, rest of the things are normal, or whether more than one or more than two or more than three domains are get affected. So when only one domain is get affected, we will call it the individual developmental problems, individual domain related developmental problems, or specific developmental delay. It is called as specific developmental delay. But when more than two or more than three domains are get affected, usually we call it as global developmental delay or GDD. Global developmental delay or GDD. Now what we are discussing today is one of the important aspects related to this, that is in terms of Ayurveda. In Ayurveda, do you find such references of global developmental delay? If so, where they are present and how it is represented? So this is the context of today's discussion. Global developmental delay has been discussed in Ayurveda, especially in Kashyapa Samhita, in many contexts. The first context in the first chapter of Kashyapa Samhita Sutrasthana Lehana Adhyaya, 29th shloka, where almost everybody knows about a very important preparation which is called as Samvardhana Grita. Samvardhana Grita. Okay. So this, the name itself suggests Samvardhana. Sam means Samyak. Samyak Vardhana. Okay. So for the normal growth and development of the child, this Grita is beneficial. And at the end he also says in the Falashruti that what are the developmental problems where this Grita can be given, which is quite helpful to come out of that problem. Okay. So before that, let us quickly see the contents of this particular Samvardhana Grita. Khadira, Prashnaparni, Syandana, Saindava, Bala, Kebuka, and these drugs are taken and their kashaya is prepared. Then 1 Adaka Jala is taken and equal amount of Kshira and as well as equal amount of Grita is taken, and then it is prepared according to the Grita preparation. The Grita is prepared, then Grita should be taken along with the Anupana of Madhu. Okay, so this is how it is prepared. Now, very important for us is look at the Falashruti. What are the benefits? Nirvyadi. So this removes the Vyadis or this prevents the Vyadis. Number one. Another one is Vardhate Shigram. It is responsible for quick development of the child. That means quick in the sense normal development, normal healthy development of the developmental milestones. Vardhate Shigram. There is no delay. Vardhate Shigram. Shigram Sarpati. Some Sarpati means crawling, and as well as you can say crawling and as well as cruishing, crawling and creeping, etc. Okay, so that means just before sitting development of the baby. In the motor developmental milestone, we have got different milestones like neck holding, then roll over, then creeping, then crawling, then cruishing, then sitting with support, sitting without support, then cruishing, then standing with support, standing without support. So these are the different set of developmental milestones in the motor domain. Okay, so what here it is mentioned is Shigram Samsparshati. That means the initial part of this initial milestones of this particular motor development, like rollover, then crawling, then cruishing, or creeping, not cruishing, crawling, creeping, then sitting with support. So this will be attained very fast. Samsparshati, जो रगड़ने चलता है, रेंगते जो चलता है बच्चा, तो वो सभी चीज़ें जो है the child will attain very faster. Then आशु गच्छति. So that means all these things are आशु गच्छति, very fast, or normally it will go into down. But in the next line he again says that Pangu, Muka, Ashruta, Jada, Yujjate, Ashu, Karmabihi. Now, if the child is having, this is the context of global developmental delay, which is explained in Ayurveda, especially in Kamarvatya. Okay, so now this is the context of GDT, where he says, suppose child is in global developmental delay. Global developmental delay means more than 2 domains are get affected. So this is an example. If the child is having Pangu, Muka, Ashruta, Jada, etc., that means Pangu is not able to walk, not able to sit, whatever. So this explains, or this explains the motor developmental domain, motor domain. Muka and Ashruta, these are interrelated. Okay, that is talking and as well as hearing, listening, auditory, and as well as the verbal developmental milestone. They are interrelated. We know that. Okay, so now Muka and Ashruta, this denotes the lingual domain of development. Okay, then Jada refers to the cognitive domain of development. Jada means lazy, you can say, or you can say less interested. So that is nothing but Jada means it is suggesting of less developmental delay related to the cognition. So cognitive domain, language domain, and motor domain, all the three are explained, and he is telling that this particular yoga is quite useful in all these conditions, that indirectly suggests that this yoga is very good for global developmental delay, any kind of global developmental delay. Yujjate ashu karma bihi. So even the child with the global developmental delay also starts attaining the developmental milestone faster. So that is the intention of this particular yoga. So this is one example, textual example or reference for global developmental delay in Ayurveda. Secondly, if you go to the Fakka Chikitsa, Kashyap Samhita, shloka number 5, if you look into Fakka Chikitsa in Chikitsasthana, he explains a shloka. What is that? Pittanila Prakritihi, Patukshira, Patuprajaha, and Tridosha Kshirasya. That means, if the mother is Pitta or Anila Prakriti, if the mother is producing Patukshira, Patukshira refers to Lavana Kshira, which is non-nutritious. Okay, non-nutritious. So that means the breast milk produced by that mother is Patukshira, which is totally non-nutritious and not advised to the baby. And Tridosha Kshira Sevi, if she is producing a breast milk which is vitiated by all the 3 doshas, and if she gives this particular Kshira to the baby, for the infant, growing child, then child will get into the stage of global developmental delay. Okay, here he also one more thing, Patu Praja. The word meaning of Patu Praja is multiparous, multiple deliveries. Okay, so multiple deliveries. So multiple deliveries will have so many other problems. We know that. Maybe having so many risk factors at the time of the birth. There may be birth asphyxia. So many problems can occur. So if the mother is having Pitta Anila Prakriti, and if the mother is producing Patukshira, if the mother is producing Tridosha vitiated Kshira, and if the baby is consuming that, so child may develop the global developmental delay. So for this he says that Kutaha, it may lead to Pangu, Jada, and Moka. Okay, if mother is producing this particular type of Kshira because of these causative factors, and if the infant is consuming that, the child may develop the global developmental delay in the form of Pangu, Jada, and Moka. So this is also explained in the context of a Fakka Chikitsa. So this is a second important example to explain or reference to explain the global developmental delay in Kaumarbrithya. Third, same in the Fakachakesa, you go for sloka number 3, almost all the first sloka, everybody knows that Balasamvaksarapanna padabhyam yona gacchati. Balasamvaksarapanna padabhyam yona gacchati. But here, when he explains this particular sloka, here the other domains of development is not included except the motor development. He is only padabhyam yona gacchati. Child is not able to walk by himself or by herself, okay, by the end of 1 year, or any disease which is persisting in the baby since last 1 year, okay, any chronic problem, whatever may be the chronic problem, if it is persisting since last 1 year, at the end of the 12th month, baby is not able to initiate the motor developmental milestones, or even after the 1 year also, baby is not able to walk. Totally what I mean to say is this sloka, although it explains of the developmental milestone, it is only referring to one domain. It is only referring to one domain of motor development. Padabhyam yona gacchati, movement. Maybe fine motor or maybe gross motor. Only motor developmental domain has been included in this particular sloka. Okay, so this is a third reference. Fourth one is in Sharirasthana Kashyap Samhita first chapter, verse number 2. It's a big shloka. In that he explains Samvaksrat urdhvam pratitishthati vachancha prasrajati. Normally a child at the end of 1 month pratitishthati, it will stand up and it will put few independent steps. Okay, it has to stand without support and it will try to walk independently few steps. After a few steps it may again fall, that's a different issue, but it will try for a few independent steps, and therefore he says that pratitishthati. Okay, so it will get up and try to stand without support and may put some few independent steps. Okay, samvaksarat urdhvam. When this will happen? After 1 year. After 1 year. After 1 year. So this will happen. But he again says vachancha prasrajati. At the end of 1 year, child will be also able to utter few of the words. Okay, ma, monosyllables or maybe bisyllables. Child has to utter at least the monosyllable word at the end of 1 year. Of course, the developmental milestone says that by the end of 12 months, the child is even able to say some of them bisyllables words. But here, Kashyap is not specific whether it is bisyllable or monosyllable or multisyllable. He is simply saying vachancha prasrajati. Vachancha prasrajati. There's a mistake. It is not pratishtati. Prasrajati. So here he covers two important domains. One is the language domain or linguistic domain, and another one is a motor domain. Okay. So these are some of the examples related to the global developmental delay or differentiation of the development into different domains. So global developmental delay concept is very well explained in our Ayurveda. Two important references we have, one is in Samvardhanakrita and another one is in Fakachakesa. Some of the other references are also there, like in Fakachakesa and as well as in Sharirasthana. When we discuss about developmental delay, there is one big separate chapter is that is samskara. Different samskaras also helps to understand the developmental process of the child. Okay, these different samskaras also act as a examination methods or a opportunity to examine the baby with respect to the developmental aspects. Different developmental milestones have been examined during the time of different samskaras. So that we will deal in another class in detail. Okay, so thank you very much, and already those videos are available in my channel related to samskara. But this is especially about the developmental domains and also global developmental delay. Thank you very much. Again, we will meet in another class. Thank you very much.